Hi everyone, I'm Dr. Samir Undavia, a facial plastic surgeon in Prince, New Jersey. And today I wanted to answer a question that I get asked a lot, and that is, what's the difference between open and closed rhinoplasty? Well, first, let's go over some basic information. So rhinoplasty is just changing the shape of one's nose. And every nose is different, so every rhinoplasty will be slightly different. And we can make a big nose smaller, a small nose bigger, we can straighten a crooked nose, and we can narrow the nasal tip. We can even fix contour irregularities and make the nostrils that are too wide narrower. Now when it comes to performing all of these fancy maneuvers, the placement of the incision is what differentiates an open and closed rhinoplasty. In both approaches, there are incisions inside the nose. And there are several different types, and they're all used to access certain structures within the nose. And for a closed rhinoplasty, all of the incisions are inside the nose. Now with open rhinoplasty, as you can see, there's also an incision between the skin of the nostrils, called the columella. And that's the fundamental difference between the two approaches. Only that tiny little incision between the skin of the nostrils. Now this incision heals really well, and almost always is pretty much invisible. So it really isn't a very big factor in choosing which approach to use. Now there's a lot of hype over surgeons using one approach versus the other, but it's important for patients to understand the true differences between the approaches. So one of the most important difference is that when it comes to revision rhinoplasty, or rhinoplasty that involves major tip work, an open rhinoplasty approach is far superior to closed rhinoplasty. And that's because for an open rhinoplasty, you can have access to certain structures that you need to place grafts in, and you can have better assessment of all the intranasal structures. For open rhinoplasty, there is a little bit more swelling, but it's only by a few more weeks, and then it comes down. For closed rhinoplasty is great for someone that has a rhinoplasty for a simple dorsal hump, where there isn't much need for graft placement, or there isn't significant manipulation of the nose. Now probably the most important factor is surgeon comfort. The surgeon will have a good idea of whether a particular rhinoplasty can be formed in a closed or open manner. So instead of choosing a surgeon that only does open rhinoplasty or only does closed rhinoplasty, it's better to find a surgeon that you know has good results and that you feel comfortable with. The approach will be chosen based on a combination of factors, but the decision will be made for that particular nose. And your surgeon should be able to explain why they chose that approach. So I hope that helps. If you have any other questions about open or closed rhinoplasty, or have any questions at all, you can email me at info@drundavia.com or call me at 609-403-8840. Thanks for tuning in. Remember, trust your face to a specialist. And until next time, I'm Dr. Undavia.